The 11th of April 2024, the Azimio coalition through its leader Raila Odinga met on the statement on doctor strike, whereby they had the following to say, and of quote, "We have reviewed the fact that members of the 7,000-strong Kenya Medical Practitioners Pharmacist and Dentist Union (KMPDU) have been on strike since March 13 to demand better pay and working conditions. The strike has disrupted healthcare at the country's 57 public hospitals. We are of view that the situation is moving from bad to worse, and soon we'll have a full-blown crisis in which all health workers will down their tools. Already, clinical officers have joined. I therefore have a personal appeal to both the government and the doctors. After very wide consultations, I am convinced that the doctors and all other health workers currently on strike will be able to craft a return to work formula and resume duty if the government were to meet their demands halfway while negotiations continue. I therefore appeal to the government to address itself to the following three broad areas as a way of progress towards ending the strike. Number one, pay for medical interns. For the last 7 years, interns have been earning Kenya shillings 206,000 per month. These are actually the doctors running level 4 and many other public hospitals. There is no way an employer can reduce the salaries of employees midstream. That distorts everything in the life of the employee. I therefore appeal to the government to reinstate the 206,000 Kenya shillings pay for interns until the next CBA negotiation, which is around the corner, kicks in. During that next round of negotiations, both parties will put their cases on the table for consideration. Number two, fees and salaries for doctors pursuing further studies. Countries are supposed to pay salaries of doctors who are enrolled for further studies like master's degree, while the Ministry of Health is supposed to pay fees. My understanding is that while counties have kept their side of the arrangement, the Ministry of Health has failed to do so since 2018. As a result, a number of doctors cannot complete their studies and graduate because of fee owed. And as they retake courses, counties have stopped their salaries because doctors have overstayed in college. I appeal to the Ministry of Health to immediately engage the doctors and their learning institutions with a view to clearing the fee balances and enable the doctors to complete their studies. The ministry must also engage the counties to resolve the issue to pay for the doctors who have overstayed in college through mistakes not of their making. The ministry should also work out a plan for paying stipend to doctors who forgo county salaries and ministry fees and privately fund their higher education while offering services in public hospitals. Such hustles should be supported. Number three, and of quote, address the problem of doctors on contract. I have been shocked to learn that some of our high-end hospitals are hiring doctors on as short as 1 month, 2-month or 3-month contracts. This is wrong. The ministry is failing to stand up for the doctors to prevent their exploitation and exposure to unfair practices. The ministry must lay down the rules that ensure fair, respectful, and sustainable labor practices by both the public and private health providers. Number 4, and of quote, equal pay for equal work. Doctors are complaining about a free-for-all system where some employers have a free hand to decide what to pay. The result has been a very unequal system where doctors hired to do the same job experience huge variation in salaries. The medical profession is too important to be managed so casually. The ministry must intervene for the doctors. Number 5, and of quote, and procedural termination of services. Appeal to counties that have terminated contracts of doctors for one reason or another to reconsider their actions and engage the doctors. The counties that have done so or that are in the process of doing so know themselves. Appeal to them to reconsider their steps. I believe that the above actions, if taken in consultation with the union, will see us avert the crisis that is building up in the health sector and pave way for the less antagonistic engagement, the Azimio leader said. Reporting for RTG TV 254, my name is Teddy Ratemo.